Heart failure is an illness where the heart cannot pump blood sufficiently around the body to meet its needs. It mainly affects older people, but can affect all age groups. Despite advances in treatment, people living with heart failure can experience frequent and distressing symptoms, such as pain, shortness of breath, swelling from a buildup of fluid, and excessive tiredness. Palliative care can be used alongside treatments for heart failure to help manage these symptoms and address the patient's physical, psychological, social, and spiritual needs. Evidence suggests that using it in this way improves the quality of life for patients, reduces use of hospital resources, and reduces costs of care. The case for giving people with heart failure timely access to palliative care is compelling. Despite these clear benefits, there is a public perception that palliative care is only needed when people are close to death, which can cause reluctance to engage with it. Some doctors who have been traditionally trained to do everything they can to cure patients also share this perception and can feel they have let patients down if they cannot offer curative treatments. There have been many advances in healthcare, but there are clear limitations to its restorative capabilities which should not be ignored. Our research has shown a culture change is needed to improve access to palliative care and quality of life for people with heart failure. Opportunities to change culture can come from the following: weaving palliative care skills throughout healthcare professionals' undergraduate studies and throughout their continuing professional development, enhancing effective communication skills, experiential learning, collaborative working across multidisciplinary teams and settings. We also need increased public awareness of what palliative care is and is not, how it can be of benefit to people with heart failure and their families, and how to access it. To work in practice, including in the NHS, people need to believe it's worthwhile. The value of integrated palliative care in heart failure can be demonstrated by sharing examples of good practice, showing benefit to people with heart failure and improved quality of life, and building relationships and trust with the multidisciplinary teams that care for people with heart failure. Good practice, high-quality integrated palliative care services for people with heart failure exists, but not everyone has access to this. Availability of services needs to be assessed to identify where services can be reconfigured to provide equitable access to integrated palliative care in heart failure for all. This may mean changing the way current services are delivered, particularly to ensure people with heart failure receive the continuity of care they need. Changing services can be difficult, but having guidelines will help. Well-functioning multidisciplinary teams with both palliative care and heart failure expertise are needed. They should assess the palliative care needs of people with heart failure. To do this well, they need to know what they need to do, when they need to do it, and how. For more information and resources to help people living with heart failure, providers and commissioners, visit our website, PalliatHeartSynthesis.co.uk.